Hey Rad ladies, today I am showing you how to do one of my favorite moves, and it is the best full body movement that you can do that works on mobility, strength, and stability. This Turkish get up is not recommended if you have a C-section or diastases because it puts a lot of internal pressure on your core going from the bottom up, but you can practice going from the top down, which I'll demo in a second. So the Turkish get up is simply going from laying to standing in a series of movements with or without a weight. I definitely recommend you practice it without a weight at first so you get the body mechanics of it, and then you can slowly add weight as you grow stronger and more stable. So I'm going to demo with a weight, and then we'll talk about breaking it down for different stages of pregnancy and postpartum. So to start, you're going to grab your weight from the side and roll it up. Because as that weight gets heavier, you're not going to want a woman handle it around. So we always pretend that the weight is glued to the ceiling, same leg, same arm are up. Our first move is a nice powerful drive to our elbow and then to our hand. Our hand can slide out to make room because we're going to get our hips up and get this leg under. Coming up to proposal stance, we then stand up. Then we're going to reverse it. So nice big proposal stance, watching the weight, hand goes down, leg comes out to glutes, to elbow, back down to the ground. To switch sides, we pull it in nice and close and roll it over. If we're finished, we roll to our sides to put it down and then push with our hands back up to sitting, which is also a great way to get up from laying if you're pregnant or postpartum. It really saves your core versus sitting up. So if you are in your first and second trimesters of pregnancy, you can definitely practice from laying to standing. You shouldn't have any problems. I would highly recommend practicing without weight first so you get a good feel, like I said before, and then slowly add weight. You can start with 10 pounds. That gives a good feedback for the movements. If you are pregnant, in later stages of pregnancy, have a big belly, or you have diastasis or a C-section where we want to work on that core stability, first and foremost, you're going to go from this top to down. So from the top, you have your weight. It's staying nice and glued to the ceiling. You can look at it, and it's going to be that nice big proposal stance. Hip can rotate here to make room, and you're going to come down to your hand. That's it. Press back up, and then stand up. So that's going to be your practice if you're later in pregnancy, have diastasis, or if you had a C-section, because this is really working that deep transverse, which is what you want. I do not recommend these movements if you have SI joint or pubic symphysis during pregnancy, because it's just going to put way too much stress on these areas because your pelvis is moving and shifting a lot. So forget this movement for now during pregnancy. You can revisit it postpartum. I love this movement with a variety of weights for a variety of reps and sets because it just is a full body movement that you can play around with, and it feels really great. And that's the Turkish get up for you. Have fun and stay safe.